Bismillah ar-Rahman ar-Rahim. Today we would like to start the histology of the cardiovascular system. We will have two separate sessions, one about the histology of the blood vessels and one about the histology of the heart. Let us start with the histology of the heart, and this is me, Omar Musa, an assistant professor in the anatomy department, University of Khartoum Faculty of Medicine. Lectures. So our objective for today is to know the histology of the heart and the valves and the conductive system of the heart, and it will be an ultra short lecture. This is the heart, and the gross anatomy of the heart is beyond the scope of this lecture. This is the conductive system explained in yellows, and those in white are the valves of the heart, and this is the heart itself. Let us start with the heart. Um, Again, this is a gross anatomical view of the heart. In this, we would like to have a small section through the wall of the heart. We select the left ventricle, and we would like to explain the gross anatomy or the layers of the heart from inside to outside. The heart falls in three layers: the endocardium, the myocardium, and the epicardium, which equivalent to the visceral layer of the serous pericardium. Of course, you know what is the serous pericardium, and this is the pericardial cavity, the parietal layer of the serous pericardium, in between the two layers of the serous pericardium, and of course the outer tough protective, the fibrous pericardium. And next to fibrous pericardium, we may observe an adipose tissue. A view about the layers. As I explained, the histological layers of the heart from outside to inside are epicardium, and it's composed of flattened cell, simple squamous cell resting on, of course, on basement membrane as usual. All the epithelial cells, I mean the surface epithelial cells, are resting on basement membrane, and this is the layer of the epicardium, and it's equivalent to the serous layer of the visceral pericardium. I'm sorry, the visceral layer of the serous pericardium. The bulk of the wall of the heart is the myocardium, and is the myocardium composed almost from the cardiac fiber. And I would like to show what are the features of the cardiac muscle fiber in a minute. I mean, in the next slide. The most inner layer is the endocardium, and this endocardium again composed of flattened simple squamous cells. We call it the endothelial cells. The cells which line the heart and blood vessels, we call it the endothelial. It's an example to flat or simple squamous cell, of course resting on basement membrane. And next, just deep to this endothelial cells, we have a dense connective tissue layer, and surprisingly this dense connective tissue layer, it do contain a tiny amount of a muscle, smooth muscle cells, as I will show. And the subendocardium contain the Purkinje fiber, which will be explained in a minute what are the Purkinje fiber. Let us a section H&E section to the heart. This is how the heart looks like. This is the most outer layer, which is the epicardium, and I have to mention that the epicardium contain the blood vessels which supply the heart. I mean the veins. The major vein is the coronary sinus, and we do have the arteries. I mean the circumference branch of the left coronary arteries. I mean all the arteries which supply the heart observe within this outer layer, which is the epicardium, and this is the flattened or simple squamous cells of the epicardium. As I stated previously, the bulk of the heart composed of this cardiac muscle fiber, and we call it the myocardium. And the myocardium, actually the thickness of the wall of the heart varies between the atria and the ventricle, and even between the ventricles. The left ventricle is 3 times much more thicker than the right ventricles, because the left ventricle pump the blood against a very high pressure, I mean the systemic circulation, and those arrowheads indicate the endocardium, the most inner layer, and the valves and fibrous skeleton will be stated on the second objective of our lecture. We do magnify this area in this section. In B, we do magnify this area. As we can see, the most inner layer is from here up to here is the endocardium. This is the endocardium from here up to these cells. The three layers of endocardium are the endothelial cells. Those are the nuclei of the endothelial cells, flattened nuclei of endothelial cells. They do line the cavity of the heart. And this is the dense connective tissue layer. DCT stands for the dense connective tissue layer from here up to here. And as I stated, we do have a nuclei of the smooth muscle cells. We may observe smooth muscle cells within the heart. This is an extremely important information. Just below it, we have this layer, as will be stated on the next few slides, the Purkinje fibers, and you should observe that the Purkinje fiber appear much more lighter and larger in size than the cardiac muscle fiber. From here up to end of this slide, we do have the cardiac muscle fiber or the myocardium, and I would like to explain in which show the differences between the skeletal muscles, cardiac muscles, and the smooth muscle. And of course, this is just revision to what have been stated last semester in the general histology course. We should comment on the cells, I mean the fibers. Is it long, tubular, branching, and so on? We already state that it's a long branching cells with a single nucleus, and this nuclei a central in position. And we do have striation, as well as the skeletal muscle contain the striation, and the nuclei are central in position, and we may see as we have stated that there is a triad in the T tubules of the skeletal muscle. Here we have a dyad of the disc. So we do have also the sacro. So the contraction is similar to the skeletal muscles, and the connective tissue also we have the same names. And of course, we couldn't observe any cardiac muscles apart from the heart. This is just revision to what have been previously stated in the general histology. And again, we disc, those are the intercalated disc. The striation is common or shared between the cardiac muscles and the skeletal muscles. Let's see what are. First of all, the heart is beating from 60 to 100 times per minute, and this subjects the muscles fiber to tear and wear. The dehiscence of these muscles fibers is prevented by the desmosomes, which are the maculo-adherents and the fascia-adherents. Both of them, I mean the adhering junction and the desmosomes, support the cardiac muscle cell together and prevent this strain or the stress and dehiscence of the fiber. I mean the separation of the fiber due to repetitive contractions and relaxation. I mean during the cardiac cycles, which the heart rate, as I stated, it's 60 to 100 times a minute. Can you imagine how many times the heart or the cardiac fibers relax and contract every day, every year? So we do have an intercalated disc. I mean those two elements of the intercalated disc, which are the adhering junctions and the desmosomes, which prevents the dehiscence or strain of the muscles fiber. Also, those muscle fiber has to function in a simultaneous manner. I mean, the contraction of the cardiac muscles of the all ventricle or all the atria has to occur on the same time. This process called the syncytium. Syncytium is the contraction of the cardiac muscles as a single unit, and this achieved only by this component of the intercalated disc, which are the gap junction or the communicating junctions. The gap junction or the communicating junctions, they do allow rapid exchange of ions, and it do provide the ionic continuity between the cardiac muscles fiber in order to achieve this function. So the component of the intercalated disc again are those three. One of them allows the communications, and two of them prevent separation of the cardiac muscles fiber during contraction and relaxation. This is the cardiac muscles, and this is the schematic presentation of the intercalated disc. Intercalated disc, which contain the adhering junctions, desmosomes, and the gap junction for ionic continuity between the cells. This is rather magnification of this area, which is the intercalated disc, and this is the rather magnification of this, which is the wall of the heart. Again, here we can observe the branching and anastomosis of the cardiac muscles fibers and the single nucleus, which are large in size and central in position. Those are the feature of the cardiac muscle as stated previously. So, end of the first of our objectives, which is the histology of the heart, and in a minute we would like to finish the so there is a special structure within the between the chambers of the heart. Those structure, they do allow the unidirectional flow of the blood through the heart, and if we lose the competency of those structure, the valve, we may have a problem in the function of the heart. The valves are connective tissue, and those connective tissues covered by the endocardial fiber, by endocardial tissues, and it's a complex framework composed of three parts or three layers. What are those? This is the wall of the heart. It do contain the very tiny layer, which is the endocardium, the epicardium, and the bulk of this will be composed of the myocardium or the cardiac muscle fiber. And the histology of the cardiac muscle fiber was stated previously. This is a structure you have came across during the gross anatomy lecture, which is the papillary muscles, the chordae tendineae, which hold the cusp of the valve in position and participate in the competency of the two atrioventricular valves, the tricuspid and the mitral valve. Here we do have this is one of the cusp of the mitral valve, and this is the lumen of the left atrium, and of course this is the lumen of the left ventricle. And this is a rather histological view of this layer, the cusp of the valve, which composed of three layers: the spongiosa, the vibrosa, and the ventricularis. And this is the atrial side, and this is the ventricular side. Let us see what are the components of each layer of those. The fibrosa, it do form the core of the valve. The cusp of the valve composed of a fibrosa, which is a fibrous extension, and it's a dense irregular connective tissue, and it's direct extension of the skeletal rings which surround the valves of the heart and the four valve of the heart. The layer spongiosa is a loose. This is a loose connective tissue located either on the atrial side or in the blood vessel side. This case in the semilunar valve. I mean the aortic and pulmonary valve. And this is it's composed of loosely arranged collagen and elastic fiber, and those are infiltrated by a large number of the large amount of proteoglycans, and it look like it do dump the vibration of the closing of the valve. I mean, the proteoglycan function like it's like a damping of the vibration which made by the closing of the valve. So the layer spongiosa is a functional, and it's almost facing the atrial side or the blood vessel side. The third layer is the ventricularis. This is immediately adjacent to the ventricles, either ventricle or, of course, the atrial surface. Again, it contains dense connective tissue with so many fiber of elastic. So the core of the valve are the connective tissue, which contain the dense irregular collagen fiber and elastic fiber, and of course the chordae tendineae attached to this side, and the chordae tendineae also attached to the papillary muscles. The third of our objective for today is to know the conductive system of the heart. As it is well known that the heart has ability to function without innervation. If we de-innervate the heart, we may have a functioning heart by a rhythm created by this area, which is called the sinoatrial node, and this is the atrioventricular nodes, and this is the bundle branch of His, and this is the right and left bundle branches, and those are the Purkinje fibers. The cells of those are not belong to the nervous tissue. This is an extremely important information. It's not a nervous tissue. It's just a modified cardiac muscle fiber. Surprisingly, the conductive system of the heart composed of a modified cardiac muscle cell. In a minute, we would like to see what are the features of a system of the heart, and this was stated previously: the sinoatrial node, the atrioventricular node. Also, we do have an internodal pathways through the right atrium, and this is a atrioventricular bundle of Hess, and those are the Purkinje fibers, and this is the right and left bundle branch, and the right also divide into anterior and posterior. This is not important regarding the histology. The most important thing is to show the features, the histological features of the Purkinje fibers. Those are the nuclei of the Purkinje fibers. Of course, this is the endothelial cells, and this is the dense connective tissue layers. And within the dense connective tissue layer, we can observe the smooth muscle cells, and this is light stained. This light stained segment is the subendocardial layer, which do contain those pale stained. It looks like the myocardium, but it's a little bit pale in stain due to presence of the collagen, a lot of amount of collagen, and the cells of this layer, the Purkinje fiber, are larger in size, and that's why the nuclei couldn't be appreciated like in the skeletal muscles. We don't have lots of the nuclei, and the arrowheads indicate the intercalated disc, which appear much more clear if we compare it with the cardiac muscle fiber. As I have stated, 1 minute before, it do contain large amount of glycogen, not collagen. I'm sorry for this. It do contain large amount of glycogen, and that's why it's appear much more lighter if compared. The nuclei surrounded by a much more lighter cytoplasm, and this is represent the extranuclear regions of the cells. Again, we can observe this is a nerve fiber. Of course, this nerve fiber belong to which we call it the autonomic nervous system. It do supply the heart. It do supply the heart, and of course the sympathetic, it do accelerate the rate of the heart, and it do enforce the rate, the force of contraction, and the parasympathetic, they do delay the rate of the heart. And there is a doubt about the if the parasympathetic, uh, it do have if the parasympathetic has an effect on the contraction of the cardiac muscle or not. But this beyond the scope of this lecture. Let's focus on the our issues is the histology. We can observe the nerve fiber which belong to the autonomic nervous system, and the intercalated disc appear much more clear, and the cells are larger in size and a bit more, much more lighter because of the presence of glycogens within the which surround the extranuclear part of these cells. Do you have any question regarding this issue? Let's go end my session by asking a question. Do the mature cardiac muscles cells has the ability or have the ability to divide? This is a rather a brainstorming question. Please think about it and put in mind what is the fate of the people subjected to the myocardial infarction. Think about this right now in your histology lessons, and let's answer this when you discuss the pathology of the cardiac muscle in the next year, inshallah. And I would like to thank you. I'm happy to receive your questions, your comments. Inshallah, we will have a very fast, short lecture. We will have a very high speed hits about the histology, and we will finish very soon, inshallah. So don't worry about this delay.